Nuclear medicine imaging systems are sophisticated devices that utilize radioactive tracers to diagnose and treat various diseases. Here's a list of the primary imaging systems in nuclear medicine, along with their functions and technical aspects. Single-Photon Emission Computed Tomography, SPECT. Function: SPECT captures gamma radiation emitted from radioactive tracers within the body to create 3D images. It's primarily used for brain, heart, and bone imaging. Technical aspects: SPECT involves a gamma camera that rotates around the patient, detecting radiation and creating cross-sectional images. These images are then reconstructed into a 3D representation using algorithms. Positron Emission Tomography, PET. Function: PET detects pairs of gamma rays emitted indirectly by a positron-emitting radionuclide tracer, which is introduced into the body on a biologically active molecule. It's widely used for metabolic and molecular imaging, especially in oncology. Technical aspects: PET scanners detect the annihilation photons from the positron electron annihilation event. The simultaneous detection, coincidence, of paired photons allows for high-resolution imaging and quantification of tracer concentration within the body. Gamma cameras. Function: gamma cameras are used for planar imaging, capturing 2D images of the distribution of the radiotracer in the body. They are useful for whole-body bone scans and renal studies. Technical aspects: a gamma camera consists of a detector head with a collimator, a scintillation crystal, photomultiplier tubes, and an electronic system for processing signals. The collimator allows for directional detection of gamma rays, which are converted to light in the crystal and then to electrical signals by the photomultiplier tubes. Hybrid systems: Peru time/central time, SPECT/CT. Function: hybrid imaging combines the functional imaging capabilities of PET or SPECT with the anatomical detail provided by CT. This allows for precise localization and characterization of abnormalities. Technical aspects: hybrid systems integrate the hardware and software of both modalities. They perform sequential or simultaneous imaging, with software algorithms used to fuse the functional and anatomical images. Theranostic systems. Function: theranostics involves the use of specific radiopharmaceuticals that can be used for both diagnostic imaging and targeted therapy. It's an emerging field in personalized medicine. Technical aspects: these systems require the capability to image and quantify the biodistribution of therapeutic radiotracers, often involving PET or SPECT technology, to ensure accurate delivery of the therapeutic dose. Each of these systems utilizes the unique properties of radioactive decay and the interaction of radiation with human tissue to provide valuable diagnostic and therapeutic information. The choice of system and tracer depends on the physiological process to be imaged or treated, the required resolution, sensitivity, and the specific clinical question at hand. Single-Photon Emission Computed Tomography. Single-Photon Emission Computed Tomography, commonly known as SPECT, is an advanced nuclear imaging technique that provides three-dimensional images of metabolic processes in the body. Here's a detailed explanation of its technical aspects. Principle of operation: SPECT imaging is based on the detection of gamma photons emitted from radionuclides injected into the patient's body. These radionuclides are part of compounds that localize in specific physiological processes or areas of interest. Components: radiopharmaceuticals. These are radioactive compounds that emit gamma radiation upon decay. They are designed to target specific organs, bones, or tissues. A gamma camera. This is the detection unit that captures the emitted gamma photons. It consists of collimator, a lead or tungsten structure with holes that only allows gamma photons traveling in certain directions to pass through, ensuring spatial resolution. Scintillation crystal, usually made of sodium iodide. This crystal scintillates, glows, when struck by gamma photons. Photomultiplier tubes, PMTs. These convert the light from the scintillation crystal into an electrical signal. Positioning logic determines the location of the scintillation events within the crystal. Computer system processes the signals from the PMTs to reconstruct the 2D projections into a 3D image. Image acquisition: the patient is administered the radiopharmaceutical and then positioned within the SPECT system. The gamma camera rotates around the patient, capturing multiple 2D projections from different angles. Each projection is recorded as a planar image, which is then used to reconstruct. The 3D image reconstruction. The collected 2D projections are processed using algorithms such as filtered back projection or iterative reconstruction. The result is a 3D volumetric dataset that represents the spatial distribution of the radiopharmaceutical within the body. Clinical applications: cardiology, assessing myocardial perfusion, identifying areas of ischemia or infarction; neurology, evaluating cerebral blood flow, aiding in the diagnosis of epilepsy, Parkinson's disease, and dementia; oncology, detecting and staging cancer, monitoring response to therapy; orthopedics, imaging bone to detect fractures, infections, or tumors. Advantages: provides functional information about organ systems, non-invasive and relatively low risk, can be combined with CT for anatomical correlation. SPECT/CT. Limitations: lower spatial resolution compared to other modalities like PET, longer acquisition times, sensitivity to patient movement. Safety: the amount of radiation exposure from SPECT is generally low and comparable to other diagnostic imaging procedures. Radiopharmaceuticals are carefully selected to minimize radiation dose and maximize diagnostic efficacy. SPECT is a versatile imaging modality that plays a crucial role in the diagnosis and management of various diseases by providing functional insights that are often not available through other imaging techniques. Positron Emission Tomography. Positron Emission Tomography, PET, is a highly sophisticated imaging technique used in nuclear medicine to observe metabolic processes in the body. Here's a detailed explanation of PET. Fundamental principle: PET works on the detection of gamma rays emitted from positron-emitting radiopharmaceuticals introduced into the body. When a positron encounters an electron, they annihilate each other, resulting in the emission of 2 gamma photons in opposite directions. Key components: radiopharmaceuticals. These are compounds labeled with positron-emitting isotopes like fluorine-18. They are designed to participate in specific biochemical processes. PET scanner. This includes ring of detectors, a circular array of detectors that capture the gamma photons emitted from the patient's body. Coincidence circuitry ensures that only simultaneous detections, coincidences, of pairs of gamma photons are recorded, which indicates a positron annihilation event. Image acquisition. After the radiopharmaceutical is administered, the patient is placed in the PET scanner. The scanner detects the annihilation events and records the spatial and temporal data of these events. Image reconstruction. The data from the detected events are reconstructed into images using algorithms like iterative reconstruction, which provides better image quality and accuracy compared to older methods like filtered back projection. The images represent the distribution and density of the radiopharmaceutical in the body, reflecting the metabolic activity of the tissues. Technical specifications: resolution. PET has a spatial resolution of about 4 to 6 mm, which is less than that of CT but sufficient for most clinical applications. Sensitivity. PET is highly sensitive to small changes in metabolic activity, making it particularly useful for detecting cancer and brain disorders. Clinical applications: oncology, identifying malignant tumors, staging cancer, and monitoring treatment response. Neurology, diagnosing and managing neurological conditions like Alzheimer's disease, epilepsy, and Parkinson's disease. Cardiology, evaluating myocardial perfusion and viability. Advantages: provides quantitative measurements of physiological processes, non-invasive with the ability to detect diseases at an early stage, can be combined with CT or MRI in hybrid scanners. Peru time/central time, PET/MRI. For detailed anatomical and functional information. Limitations: exposure to ionizing radiation, although the dose is typically low, requires sophisticated equipment and production of radiopharmaceuticals, which can be costly and complex. Safety considerations: the radiopharmaceuticals used in PET are designed to decay quickly, minimizing the radiation dose to the patient. PET facilities follow strict guidelines to ensure patient safety and the quality of the diagnostic information obtained. PET imaging is a cornerstone of modern medical diagnostics, providing critical information that guides patient management and treatment decisions. Theranostic systems. Theranostic systems in nuclear medicine represent a transformative approach that combines diagnostic imaging and therapeutic intervention. This dual functionality is achieved through the use of radiopharmaceuticals that can both visualize and treat diseases, particularly cancer. Here's a detailed explanation. Conceptual framework: the term theranostics is derived from a combination of therapeutics and diagnostics. It involves the use of a single agent or paired agents that can diagnose, monitor, and treat medical conditions. technical aspects. Radiopharmaceuticals, these are the cornerstone of theranostic systems. They are designed to target specific biological pathways or cell surface receptors. For diagnostics, these agents are labeled with gamma or positron-emitting isotopes. For therapy, they are labeled with beta or alpha-emitting isotopes that deliver cytotoxic radiation to the targeted cells. Imaging systems. Theranostic agents are visualized using PET or SPECT imaging systems, which provide information on the distribution and uptake of the agent. This allows for the assessment of the expression of the target and the potential responsiveness to the therapeutic component. Treatment delivery. Once the diagnostic imaging confirms the target's presence and biodistribution, the therapeutic isotope can be administered to deliver targeted radiation therapy. This targeted approach minimizes damage to surrounding healthy tissues. Clinical applications. Oncology. Prostate-specific membrane antigen, PSMA, targeted radioligands are a prime example, used for both imaging and treatment of prostate cancer, neurology, cardiology, and inflammatory diseases. While oncology is the primary field of application, theranostic principles are also being explored for conditions in these areas. Advantages. Precision medicine. Theranostics epitomizes the concept of personalized medicine by tailoring treatment based on the patient's specific disease characteristics, efficacy, and safety. By confirming the presence of the therapeutic target before treatment, theranostics ensures that only patients likely to benefit from the therapy are treated, reducing unnecessary exposure to potentially harmful therapies. Challenges and future directions. Regulatory hurdles. The development and approval of new theranostic agents involve navigating complex regulatory environments. Cost and accessibility. The production and application of theranostic agents can be expensive, limiting their availability in certain regions. Theranostics is a rapidly evolving field, and its success in prostate cancer management has paved the way for its potential expansion into other areas of nuclear medicine. The integration of molecularly targeted imaging and therapy holds great promise for advancing the diagnosis and treatment of various diseases.